So this is about crown and bridge preparation by me. Okay, so the first thing first is to check the medical health history about the patient to review any allergies or physical conditions and any new current medications. Then you will discuss the shade with the patient for the crown or bridge. You also want to make sure you're using the shade guide with natural lighting. And after the shade has been chosen, you as a dental assistant will complete the lab slip with the patient's name, restoration shade, and the type of restoration type that is being used, and also the due date, and that will be sent to the lab technician. After that, a preliminary impression is taken, and then you will have your tray setup prepared, which will include the basic setup, the local anesthetic, the fast handpiece, the impression materials, and any accessory items such as a mixing pad, tampon, saliva ejector, cotton, and the articulating paper and holder. So after you have your tray set up ready, you will apply topical anesthetic to the patient on the area that is being worked on. After that, you will prepare the syringe, the anesthetic syringe, for the doctor to anesthetize the patient. And then the doctor will take a fast handpiece with a diamond burr, and he or she will prep the tooth so the tooth will look a little thinner for the crown or bridge to fit. And then a retraction cord is placed. The cord can also be soaked into Hemodent to reduce any bleeding. And then placing the cord, it will be used with a cord packer instrument, and it is left in for 5 minutes. After 5 minutes, the gingival retraction cord is removed. Before the impression, you want to make sure you blow air on the prepped area. And then the light-bodied material with the extruder gun is prepared, and you will pass that over to the doctor, and the doctor will apply the light body material over the prep tooth, as well as focusing around the margins. And then while he or she is doing that, you will prepare the heavy body material in the impression tray, and we'll pass that over to the doctor. After those materials is taken, then a occlusal registration is taken as well. And then a provisional coverage is placed using tampon to seal the provisional crown or bridge. A mixing pad is also used to mix the tampon, a saliva ejector, some cotton, and articulating paper. The types of provisional crowns can be used is the performed provisional crowns, which can just be cemented onto without any adjustments to it. Also, you can also do a custom acrylic provisional crown or bridge using the preliminary impression taken before. And any cement that is, slipped out onto the crown or bridge, you will remove that with an explorer, and as well as floss to not irritate the patient's gum line. Then you will provide patients instructions for the provisional to bite and chew carefully on the side on which the provisional is placed. Also, when flossing, do not pop up with the floss, or else the provisional will become loose or maybe damaged. And if anything happens to the provisional, call the office immediately. So after that, when the patient returns, a provisional crown removing forceps can be used to remove the restoration without risking damage to the margins. And then the permanent crown or bridge is returned from the laboratory, and it is tried on the prep tooth, and it is also cemented by the doctor.